We are good.
Okay, let's go ahead and get things underway. So we'll call the meeting to order. And there is no public comment. There is a person from the public sitting in, but no comment there. As far as approval of the minutes, I read the minutes from the last meeting and everything seems to be in order as far as I'm concerned. If anybody has any corrections to the minutes, bring that up. If not, may I have a motion to approve the minutes?
I'll move that we approve minutes.
Second?
A second.
Thank you, Karen. All in favor? Aye. Anybody opposed? Okay, so the minutes will pass. Then on to reports. The health inspector's report is first. We got a number of reports, but I guess they were from the fire company that came in separately. Let me see, is there somebody here from health inspection? Is Charlie, are you gonna give us a report today?
Sorry about that. I was muted. We did 61 regular inspections, 13 rechecks, 6 animal complaints. One of the biggest ones we're working on in the animal complaints is a single family home with 51 cats.
Ouch. Yeah, we had those problems years ago. I haven't heard anything about those issues in years. So I guess, is this a repeat offender, or is this?
No, this is a new one. Once or twice a year, we come up with something like this.
Yeah.
It doesn't happen very often.
In the city, and these cats are all in one home?
Yes, 51 of them.
Oh.
And that was after the individual surrendered 10 of them to the Animal Rescue League.
So where does that stand at the moment?
We currently have a notice of violation. Go ahead.
Right. No, go ahead.
We currently have a notice of violation, and it's just getting ready to go to citation because they have not applied for a permit to have that many animals, anything over 6, and they have not shown anything about any of the animals being vaccinated. So the next thing will be moving to a citation and taking it before MDJ.
And for those of you who have joined the board in recent years, a number of years ago, we had some issues like this, and there was a rule that was passed that if you're going to have more than 6 animals, you had to have a permit for it, and there were some other things. So there is something in place to try to help those people. I've heard, I guess most of them are hoarders. That's what I've often heard. 50 cats, that's a little nuts, but whatever. Anything else to report? That's unusual.
No, that's it. We're going to a new computer system, so it's kind of been all hands on deck for the last 4 weeks for that.
Okay, all righty. And as far as the next topic is lead abatement, and I think Gerald Mendez wasn't going to make it today, but I think there was a very short report that he submitted. I don't have that right in front of me. Do you have that, Michelle?
I do. He says that 20 homes have been abated, 12 are in process. 21 have had radon levels checked, with 3 needing a radon fans installations, and he is looking for additional referrals. So as a reminder, city homes with children age 6 or younger, I believe it is, to refer them to the program to check for lead levels.
Now, how did they get off on the subject of checking radon levels? I mean, that's a whole different topic.
Yeah, I don't know the answer.
Were they in a home that there's no correlation that I know of between having lead in your home and radon. So I'm just curious as how that came up or why they would have checked it in the first place. Who knows?
So there doesn't need to be any incidents of like exposure listed. Just if you have a child under the age of 6, they can be referred for testing of the home. Okay.
Yes.
For radon specifically.
For the
I didn't
lead.
know that.
For the lead, yeah. I can put an
the lead I
email
understand.
out.
It's the radon
Yeah.
I'm trying to understand.
Yeah, I
No,
don't know how that got in there.
Yeah, sorry. I was just clarifying the referral process because, we could maybe outreach to some agencies and remind them of the program, I guess you would say, or the
Right.
city could reach out to some.
Doesn't the radon have something to do with the Healthy Homes program?
I don't know what that program is, Charlie.
They were talking something about it. It's another program in addition to the lead that they're attempting to bring in. I don't know all the details.
Don't know.
I'll send Gerald an email and ask him to clarify that, and I'll send it out to everyone.
Yeah, I mean, I don't think it's a bad thing testing homes for radon. I was just curious. I mean, up in the section I live, I think just about every home that we tested, we tested ours, and we had some, but the level was like intermediate, and from what I read, unless we spend time in the basement or live there, so I ignored it. Yeah, it's clearly is a problem for some people. Okay, on to the emergency services. Is somebody going to report on that? We have quite a bit of information that came in the form of tables. They sent us like a whole year's, like the month summary from each month from last year. And then we have this month's summary. And what I was mostly doing is just comparing the month of January this year to the month of January last year. And as I look column by column, I didn't see any, gross changes or anomalies. So it didn't seem like there was any difference in the pattern of what they were seeing. But do you know if is there anybody here from the fire service? Okay,
Yes.
Oh, okay. Oh yeah, Michael, I see. There you are. Thank you. Anything to add?
Just real quickly, like last year, obviously we topped out at close to 19,000 911 calls that we actually responded to. We probably, if memory serves correctly, I want to say probably like 1,800, 2,000 calls we outright missed because all our units were in service on calls. I was actually at a 3-hour long meeting today with various EMS agency leaders as we talk with the Centers for Excellence in Local Government, the CELG from out of Albright, to discuss basically the crisis in EMS, pretty much like anything in healthcare. Everybody's short-staffed. There's a greater need, and the costs are rising. And one thing you may take notice is several months are traditionally, when I first started here in 2006, working as a paramedic, we almost never went out to Berks County to cover calls, or if we did, they were very minimal. There are some months throughout the year 2023 that we actually did as many calls going out as coming in. And the only downside to that is, we don't mind helping our neighbors, and obviously our neighbors help us. But the concern with that is that takes one of our trucks out. If you go to Spring Township, depending on where you are out there, go past Exeter, that's a longer turnaround time for our unit to go available at some point. Fortunately, we've maintained almost all our transports go to Reading or St. Joe's, but the way the state law is written, if you're down past Exeter and someone wants to go to Pottstown and it's feasible, meaning it's not a trauma, we are obliged to take them to Pottstown. So again, as time goes on, we're keeping an eye on it and monitoring everything. We're hoping, we just want to make sure that we provide, the service to the citizens and visitors of Reading.
I looked at that one graph and I just caught my eye that in the month of December, like the week of Christmas, it seemed like the calls went up. Do you typically get more over Christmas or holidays, or is that just a fluke?
It varies from year to year, but usually for holidays we do have a lot more. Obviously more people are gathering together. Sometimes there's medical issues, or sometimes there's issues that involve, alcohol or whatever. And, a lot of people in a space sometimes there could be issues there.
And where do things stand right now with COVID calls? And you're fine with equipment, personal protection equipment, masks, everything you need in that regard, I presume you're okay with?
Yes, doctor. We haven't really seen a lot of COVID calls per se. I think in the last 3 months, we've had maybe 2 of our people have a mild case of COVID, and that was about it, which we're very grateful for. Personal protective equipment, we have ample supply of that, and everyone who works EMS is issued either a ceiling like half mask or a full face mask if we end up going that flu, RSV, COVID route. So we have stepped up our game since COVID first began.
While we're on the subject of COVID, just out of my own curiosity, if I could ask Dr. Schwartz and Dr. Wang, as clinicians on the front line, where are you seeing COVID? Does it seem scarier now than it was a couple months ago? Everything seem under control?
Yeah, I mean, again, we had a big spike here right before the holidays. So it's very much out there, but mostly it's like a sinusy type thing. That's what people tend to come in with, like it's just a cold. And, again, usually something's a little different, a little too fatigued, a little too much of a headache, and then it's positive, but definitely seeing people rebound a lot faster.
Yeah, I wonder whether there's some people who just don't bother testing now. It's like they say to themselves,
Yeah.
What's the difference? I'm guessing. I don't know.
I'd say, yeah, I think there's a lot less testing, but usually when we do or someone does, there was, again, one thing that was a little odd for a cold, like too much fatigue, too much headache. And then it ends up being the difference.
One other question, it's really off the subject of COVID, but it was in the news yesterday. And I'm just wondering whether it's hitting the radar of the infectious disease people and that message is coming to you, something about some species of Candida, some fungus that has no antibiotic, and it's wreaking havoc, I guess, particularly among immune compromised people. You read this stuff on the internet. I didn't see a medical study about it, but I just wondered, is something that's out there that we should worry about? So I just wondered whether you guys on the ground are hearing anything about it.
I've seen that too. I followed that species resistant. So I can say that from Towers Hospital, we haven't gotten any, again, ICU updates, critical care, that we're seeing these species. But I've definitely read those articles as well.
Okay. All right, good. I'm glad it's so at least it's not in this community and no issue at the moment. Okay, good. All right. Anything else on the EMS issues? Let's move on to the health literacy program. Caitlin, did you have a presentation or some things you wanted to say, or
yep, I'm going to
Dr. Brookins?
Absolutely. I'm going to throw it on over to Dr. Brookin.
All right.
Okay.
Thank you, everyone.
Welcome.
So we are in the last 5 months of this particular grant. We just completed 2 assessments, one being our second round for the health literacy questionnaire assessment. And the first round we administered here in the city of Reading. And the second round, we administered the survey in the Berks County area. Reason being is because it gives us a larger perspective of the health literacy of both the city and the county residents, then having a better understanding of the health literacy levels and the needs of the city and county residents allows us and local health serving institutions to continue in addressing health literacy and supporting sustainable change within our community. Both assessments with the health literacy questionnaire is in analysis right now. The COVID-19 vaccine hesitancy, we administered the second round of that, and that is also being analyzed, and we're awaiting the results from that. We have an initiative that we're working in called Misinformation Community Sessions, where we have conducted various sessions throughout the community, continuing to still do that, and we have some still scheduled to help our community members to think critically about where they get their health information and if the sources are credible, and how to determine what is a credible source versus what is not. We have partnered, and I don't know if you saw us on the 69 News as they had coverage for this particular one, but we have partnered with 6 health serving institutions as we awarded $20,000 to each institution to address health literacy in their organization. The organizations went through an organizational health literacy assessment, and recommendations were made to help build organizational health literacy through implementing various projects and services. The 6 organizations are Berks Community Health Center, Berks Counseling Center, Faith Care, Penn State Health, St. Joe's Medical Center, the downtown location, Reading Community Pharmacy, and the Reading Hospital Health. With the organizations, many of them have updated their signage. They've also incorporated more professional development with their staff and the onboarding of their, like Faith Care has a volunteer, they volunteer, so they have created some onboarding videos that are geared to health literacy, as well as within Berks Counseling Center, they have incorporated a survey where they've asked various questions to their clients about health literacy so that they can be better prepared and better serving to their clients. Many of the organizations are also distributing health information to clients that is more health literate and it follows the class standards. And then staff are undergoing some certificate programs to become certified, or not really certified, but they go through a certificate program to have a better understanding of health literacy. And then at Penn State Health specifically, they're increasing the number of clinical staff approved to interpret for their patients. And there's a lot of pamphlets and that are going to be interpreted into the Spanish language. So that completes our report.
Well, thank you. Caitlin, do you have anything else you'd like to add?
No, she pretty much covered it all. So we
Right.
haven't seen you guys in a while. So, you know, we've
Right.
really made some leaps and bounds from the last time we saw you, especially working with our organizations.
Yeah, I'll be interested when you get more of the data all consolidated and start and, you know, see what conclusions you can draw, what you learned that you didn't know before, that sort of thing. All right, well, great. Keep us posted. Come back. We'll see you soon. All righty, on the subject of old business, I don't know of any old business offhand. Anybody have any old business that we need to talk about? All right, then let's move on to new business. At our last meeting, towards the end, Jordan Henning brought up the fact that he was happy to see that, I don't know where he read it, but they were budgeting for some social workers to work with the police department. So they were kind enough to come today. And is Cheryl here? Oh yeah, there's Cheryl. I'm not just who is Cheryl Penny. I don't want to butcher your last name, is the captain of police, and she was going to give us a little bit information on the social worker program. I think some of you got some information regarding the job duties, qualifications, etc., which are quite lengthy. So, Captain Penny, do you have anything? What can you tell us?
Hi. Basically how the program kind of came up was obviously there's a need, especially within the city, to try and come up with additional or alternative ways to deal with individuals who may be calling the police for assistance that's not necessarily police related, and are taking time away from officers dealing with emergency calls or other actual police related calls. We had actually gone out to Lancaster City, who has a police social worker program that they've had in working for probably about 2 years now. Met with their social worker out there. They kind of gave us what they had for what they were looking for, what they did, and such. It's not necessarily having someone with us to respond to all like crisis type calls. We're looking for someone basically to kind of help on the back end with the follow-up or getting the clients in touch with resources to assist them, so that way the police aren't having to go out again and again and again for something that's not police related, where it's be it mental health, be it Office of the Aging, basically to help go and coordinate between county and city resources, and not monopolize a police officer's time kind of thing. They would be here normally during working hours. So if there was something that our officers needed, they could potentially respond, but we're looking at basically doing more follow-up than anything else, not necessarily going out for in-progress crisis-related issues.
Captain Penathy, do you have any idea of either percentage or absolute numbers of how many calls would fit that category? I'm sure there are a lot of times when police get called, it's like, oh, it's the same old crazy lady. She calls us every week. Do you have any sense of the scope of these? You know, how often she could be used?
It's a lot. Yeah, it's a lot. I don't have numbers off the top of my head, but just going through daily calls,
You'll keep
there's,
her busy.
yes. Yes, that's why we're ideally looking for two, one working, kind of like an 8 to 4 kind of thing, and then one working a 3 to 11 kind of shift, so.
Now, how does that play out? I mean, let's say, a policeman goes and realizes this, this person has some real psychological issues. She's just not, having a bad day. This is something more. So the social work comes in, but how, then I guess the question, being a little cynical, is how often are these people going to respond to receiving help or care? But all you can do is offer.
Honestly, from what Lancaster was saying, what they're doing, they'll occasionally respond out to scenes, but they're not going out for every single call, just because it's not feasible to go out to every single call.
Right.
And what they do is they kind of go through and say our officer goes out, has an interaction with somebody who called the police. It's not an in progress issue or something that needs immediate assistance, but hey, okay, this person could use some additional resources, be it connection with someone from Holcomb for additional mental health assistance, or as I said, like Office of the Aging to try and get them in contact with their resources. They would basically have a report sent to them, and then they can go do follow-up. Okay, how many times have we had interaction with this person? What has been the primary complaint? And then be able to reach out to that person. Hey, what's the issue? Do you need help with this? These are some resources that we can offer you to try and, I mean, obviously you can't force a lot of the people to take
Right.
assistance, but if they don't know that there's certain things or what steps they need to take to get these resources, that's where we're looking for the social worker to kind of help make that bridge, to be able to have, like, I don't want to say a warm handoff, but kind of a warm handoff to connect them with their resources. We're not looking for someone to be a caseworker for these people. It's basically the middle person to connect them to resources and then go from there.
Yeah, and that makes sense, because I'm sure there are a lot of people out there who need resources and really don't have the means or understanding of how to reach out. So you won't reach
Absolutely.
everybody, but it'll help some. It's a great
Absolutely. And
start.
if we can,
It makes complete sense to me.
yeah, and if we can go and even take out like even a small percentage of the residents of the city who are in need of those type of resources, or even they don't know how to access them, to be able to connect them, and then that takes away from them calling 911 or calling the police, or even EMS for things that they don't necessarily need the emergency services for. That would basically be beneficial for everybody all around. The same
Is there
thing
any
where
timeline on when this would get up and running, or is it just a matter of how soon they can find their correct person?
it's pretty much as soon as we can have it put out and find the right person. It's already been budgeted for 2 positions for the 2024 year. So as soon as we find the right person or persons, we can start rolling out.
In Lancaster, was there any use of the social work position in like a community policing capacity, like as mediators, or connecting people to legal aid for any type of like property disputes, or like things that the police can't really do anything legally wise, like, the neighbor doesn't return somebody's stuff and but charges can't be pressed kind of situation? Would that kind of be something that they were looking at doing?
Honestly, I don't know. Most of their stuff wasn't having to do anything with like legal or giving any kind of advice like that, because obviously you need to be specifically trained, and I don't really know of a whole lot of people who have gone through the social worker side that would also have training and knowledge of that aspect. So I really can't answer the questions because I don't know.
Well, I guess I'm sure the process as it unfolds and it will evolve depending upon how it goes and where the needs are. But it sounds like a great start. I would think there ought to be a couple social workers in every school too, probably nowadays. But there's so many people in need.
No,
Well,
absolutely.
thank you so much. And does anybody else have any questions or comments regarding that subject? Okay, well then I think we are at the end of the agenda. So the only other question is to talk about when our next meeting is. Typically that would be in 2 months, first Tuesday, which will be April 2nd. I might be in transit to Indianapolis for the big event. Is there anybody here who doesn't know what the big event is in April? Come on, anybody? Anybody know? It's a total solar eclipse of the sun, which very rarely happens. And it's coming through the Thousand Islands and it's sweeping diagonally right through Indianapolis where my daughter lives, and it's coming down through the country. And let me tell you, if any of you have any ability to get out to see that, I've never been to one. I'm an astronomy buff and I have a lot of friends who have traveled to multiple ones, and people say it's a life-changing experience. But if you decide to make a trip to go someplace, try to go somewhere arid, because I'm afraid in Indianapolis in April, the chance of having a clear sky is pretty small. But I'm all hyped up for it.
I was in like the 80% range for the one in 2019 that went over the southern
Right.
US. So like we got 80% of it, but not it was like another 2-hour drive south to get into the 100%.
Yeah, and I
area,
remember I've been some near to it. It's pretty cool. You can look up with the eclipse glasses and see what's going on. But honestly, if you didn't know about it, you might even just think there's a cloud up there. Whereas during totality, it's a different story. You can stare right at the sun because the whole sun's blocked. All you see is the corona, and it's just, yeah, I would love to see one. So I've been waiting my whole life. So I may be in transit that day, but I'm not sure which day we're leaving to go out, but we'll figure something out. Maybe my iPod has a cell phone in it now, so maybe I can even do it from the car. So we'll figure something out. All right. And any other comments for the good of the order from anybody? Well, thank you everyone for coming. I appreciate your time. Does everybody feel pretty good about continuing this on Zoom? It just seems to be so much easier, especially from the people who are, the fire people and the police. I mean, everybody doesn't have to schlep into City Hall. Is everybody okay with just doing it like this?
Yes.
I think it works. Yeah, I think it works well for everybody. Okay, great. All right. Well, then talk to you near the eclipse.
Thank you,
All
Sergeant
right.
Pensany.
Thank you, everyone. Goodbye.
Yep.
Oh, we need a motion for adjournment.
Oh,
Yep.
motion to
Make a motion, we adjourn.
I second.
All right. Anybody opposed? Okay, we're out of here. Thank you. Bye-bye.
See ya.